If the movement of your wrist and hand is limited or restricted, it may be beneficial to apply self-mobilization. The wrist and hand can move in 6 basic directions. Directions 1 and 2 are shown here. Directions 3 and 4 are demonstrated here, as well as movements 5 and 6, which require movement of the forearm relative to the wrist and hand. To apply a mobilization force, simply lie your forearm along a relatively firm surface, like a bed, a tabletop, a countertop, or maybe possibly the armrest of a chair. As shown right here, we can see the joint line of the lower 2 bones of the forearm as they meet with the bones of your wrist and hand. To apply a mobilization, simply take your opposite hand and grasp the hand just beyond the level of the joint. Taking this hand, direct a path perpendicular to the ceiling. From this position, simply press down into the bones of the hand to effectively push the hand in a downward direction while the tabletop supports the forearm. This will encourage movement right here in the wrist and hand to allow those bones to glide more freely and facilitate movement such as this. So again, grasping just beyond the level of the joint line, and with this arm perpendicular to the ceiling, press down. The amount of force placed in the hand is going to be relative to your tolerance. At times, an aggressive force may need to be applied, and other times, a mild, gentler force can be applied. In either case, we want to reassess and look and see what kind of motion we have achieved after a mobilization. Other mobilizations for the wrist and hand include performing a palm up position. Again, grasping that wrist and hand just beyond the level of the joint, directing this arm perpendicular, and pressing down. And assessing movement afterwards. As shown earlier, the wrist and hand also has the ability to move in these 2 directions. To encourage these movements, simply grasp beyond the joint line, direct the arm perpendicular, and press downward toward the floor. Assess your movement after your mobilization. To correct, or rather improve, this direction, simply wrap your hand around and pull up while refraining from allowing the forearm to lift up, as shown here. Recheck your movement. The last directions for the wrist and hand include the ability to allow the forearm to fully palm up or palm down position. To encourage these 2 movements, simply take this aspect of your hand and brace along the forearm along the thumb side border. Simply press in a manner that encourages your palm to move further skyward. The last and final direction is a palm down position. Again, we can use this aspect of your hand and placing it right along the thumb side ridge of the forearm and press the forearm down to effectively bring the hand into a palm down position. Mobilizations can be applied aggressively or minimally, but do it to your tolerance. And any given mobilization should be applied anywhere between 20 to 30 thrusts.